Traumatic brain injury. So many people encounter this, suffer this, and then deal with the symptoms for a very long period afterwards. And yet there seems to be so little explanation as to why these symptoms linger for so long. Hi, I'm Gabriel Newman, neuropsychologist practicing in the Towson area of the city of Baltimore, and have been treating head injury for an extended period of time, during which I've come to understand these mechanisms of the brain, how the damage is inflicted upon the brain, and also how to help people recover from these awful consequences that they suffer for years after. So in this series of videos, I'd like to bring you an explanation to try and understand better the inner workings of the brain, structural issues, and the functionality, of course, how function is changed by virtue of these injuries. So let's take a look at the minutes or hours that ensue after an injury. There's an impact, whether the head is knocked, literally physically banged, or whether the person is just shaken up quite a bit so that the brain experiences a sort of a ricochet effect inside the skull. In either case, there's going to be an inflammatory reaction. We'll refer to this as the immediate acute inflammation going on in the brain. This is inevitable because, like all tissue in the body, the brain tissue is going to respond to that assault with a process of inflammation, bringing blood to the area, bringing more fluids to the area, the objective of which is to wash out some of the toxins, to create a blood flow, to warm up the area. That's going to also bring with it healing. Of course, in the rest of the body, this is necessary, it's wonderful, it's exactly what the body needs. Here's the problem in the brain, though. As you know, the brain is contained in an unyielding skull. That skull is like a hard steel vault almost that will not flex. And therefore, as the brain swells up and increases in volume, pressure is going to be brought to bear on all of the structures of the brain, as well as the lower structures which take us down into the thalamus, hypothalamus, cerebellum, perhaps even the brainstem. This is the immediate effect. Now, assumedly, that inflammation is going to go down over time. And if so, then of course, the brain will come back. It is true that the neurons of the brain are quite resistant to damage, much more resistant than we've given them credit for. And they can suffer quite a few impacts and assaults, and yet come back, spring back to their original function. But the question becomes this: what if they don't spring back right away? What if that acute inflammatory process leads to a more chronic sort of a state in which the vascular system is now compressed and therefore not managing to deliver as much blood to all of the neurons in the brain as before? This will result in a mild but ongoing, constant chronic inflammation, whereby the neurons can be slightly deprived or more than slightly deprived of the oxygen supply that they need. What would happen if that occurs? Well, that inflammatory process is going to become a loop that just sustains itself over time. In other words, more deprivation of oxygen, more inflammation, causing more deprivation of oxygen, and round we go. This is the end of this first presentation, explaining the immediate reaction and why the sequelae are set in motion after a brain injury. Please watch the next segment for us to go into a little more detail about this.